We are talking today about the signs of pregnancy. How will you know if a woman is pregnant? Are there some signs you can determine that a woman is pregnant? When someone is pregnant, what are the signs to prove that she is pregnant? This lesson is going to be more important to those of you studying nursing, those of you studying midwifery, those of you studying medicine, those of you who wish to be health personnel at any level. You will be interested in understanding the signs of pregnancy. That is why I will be more scientific in the explanation of the signs of pregnancy. Now, we all understood that pregnancy is a state at which a woman is carrying a pregnancy in her womb. We also said that pregnancy is a period from conception up to delivery. And we also understood that once the sperm cell fertilizes an egg in the womb of a woman, in the fallopian tubes, the fertilized egg moves to look for a fertile ground in the uterine cavity where decidual lining has been formed. And then it bores and implants itself and has a good sitting in the uterine tissue, at this decidual tissue in the inner lining of the uterus. When it embeds itself there, it begins to grow. And we all also said that, we also understood that a pregnancy from the day of fertilization, from the day of implantation, up to 3 weeks, 2 to 3 weeks, the product is referred to as a zygote. From the 3rd week up to the 8th week, from number 3 week up to number 8 week of pregnancy, the product of conception is known as the embryo. An embryo. But from the 9th week of pregnancy up to delivery, the product of conception is known as the fetus. But now, is it only the fetus that is in the womb of the woman? No. The fetus is connected by a placenta to the womb of the mother. Therefore, there is an umbilical cord linking the fetus to the placenta, then to the mother. All of this while the fetus is growing in the womb. That fetus is swimming in fluid because it is in a sac, as we described in the previous video. That sac that we refer to as amniotic sac, and the fluid is amniotic fluid. And it keeps secreting it until the organs of the baby are formed. When do organs form? The organs in a fetus forming in the womb, the period of organogenesis is between the 3rd and the 8th weeks of pregnancy. Once you get pregnant and the pregnancy has made up to 3 weeks, the organs of that baby have started forming. And they will be forming between the 3rd week up to 8th week. Those of you who like to term it in months, you will say that it's just between 3 weeks. That is not up 1 month, but spans up to 2 months. That is from the 3rd week up to the 8th week, from the 8th to the 9th week, meaning that up to 2 months. Once a pregnancy is up to 2 months, it has already gone through organogenesis, the genesis of organs, the formation of organs. And we are talking about major vital organs, like the heart, like the liver, like the lungs, like the brain, like the kidneys. The major organs are formed as early as within the first 2 months of pregnancy. This is very important for us to understand. I said, especially for those of you interested in studying to be professionals on health care, to be healthcare professionals. Now, the signs and symptoms of pregnancy begin to develop, begin to show, begin to express themselves as the pregnancy grows. As weeks pass, as months pass, the pregnancy begin to grow and develop, and then the signs begin to become more prominent. For this reason, we are going to study the signs of pregnancy in 3 groups. Group 1, we will be talking about presumptive signs. Group 2, we will be talking about probable signs. And group 3, we will be talking about positive signs. Ladies and gentlemen, understanding the signs of pregnancy is a bit deeper. Like I said, there are presumptive signs, there are probable signs, and there are positive signs. What are presumptive signs? Just from the name presumptive, it is clear that it is presumed that the woman is pregnant. Those signs will actually come up when a woman is pregnant, but they are not confirmatory that the woman is pregnant. Because certain disease conditions, just because of the health of man can fluctuate. Certain moments the person suffers some minor ailments. It is the reason we will say that some signs could show up and you feel that the woman is pregnant, but it might be because of some change in the body, some disease in the body, some hormonal change in the body. However, if a woman is pregnant, presumptive signs will all be present, but you will need to do more confirmatory tests before you confirm. What are presumptive signs? 1, amenorrhea. Amenorrhea is absence of menses. If menses skip, yes, this happens when a woman is pregnant. But be careful. Menses may skip. A woman may miss menses when she is not pregnant. This is why amenorrhea is presumptive. It's a presumptive sign. Now, number 2, presumptive sign, morning sickness. When we describe it as morning sickness, it is a combination of changes, including nausea, vomiting, body weakness. When you put all of this together, we refer to it as morning sickness because the increase in the morning hours upon rising from bed. A woman wakes up from bed early in the morning who is pregnant. If she's not careful, she's going to feel weak. She's going to be nauseated. She feels like her neck is turning. She feels like she can throw up. She feels like she can vomit. Some feel like so, and they also vomit. And the vomiting must be very moderate, because if the vomiting becomes excessive, it is pathological. Now, what do I mean by being pathological? It means it becomes a disease, like what we call hyperemesis gravidarum, a case of excessive vomiting in pregnancy. That is a disease, but a woman could normally vomit moderately because of pregnancy. Yes, there's a lot of irritation from irritation of the vagus nerves from the pregnancy hormones. Okay, and this is why we consider it as normal. It doesn't make the woman sick, but we describe it as morning sickness. Now, there may be breast changes. They are presumptive signs. The breast may increase in size, they engulf, they enlarge, looking shiny, the skin around the breast become more pink, okay, and then around the tip of the penis become darker, and then the nipple, around the nipple there is an area that becomes darker, but shining but dark. Then the rest of the skin is pink. So it looks like that breast has been decorated. It's like the lady has has they have done some what they call makeup on the breast, but that makeup is natural, nature. When such a lady exposes the breast, you could see that this woman is pregnant. But we say it's a presumptive sign. Now, there could be frequent urination. A woman could be urinating, very frequently. Maybe after every 1 to 2 hours, she's going to urinate. After 2 to 3 hours, she's going to urinate. It might not be a case of infection. It may just be that she's pregnant. That's why we call it presumptive, because an infection like cystitis, like an infection of the bladder, okay, an inflammatory process involving the bladder, it could cause frequent urination. But we are talking about pregnancy. When a woman is pregnant and her womb starts growing, it will cause this frequent urination. In this case, we say the scientific backing behind it is that the womb is growing in size. And so it's compressing, on the other organs around there, around the pelvic cavity down here. Down the pelvis here, down there in the pelvic floor, you have the urinary bladder and you have the rectum. The bladder is right and anterior in front like this, but behind is the rectum. And the uterus, the womb is in the middle, in the center. When they start growing in size, it's obviously going to be compressing the bladder in front, reducing its space inside. Urine drains from the kidney down to the urinary bladder. So the urinary bladder easily gets full because the space inside is now small. The pressure inside increases. Little urine comes in, is already full, and gives impression and gives a feeling that the bladder is full, and the woman feels to go and urinate, to go and pee. And so once little urine accumulates, she feels like to go and pass out. But she'll go and urinate just little quantity. This is to tell you that there is obstruction, there's compression on the urinary bladder. And that compression is coming from the growing womb, from the growing uterus. That is why a woman whose pregnancy is still in the early period, like this within 2 to 3 months, or from 8 to 12 weeks, you will notice that the woman suffers frequent micturition or frequent urination. Now, there is equally what we call Braxton Hicks contraction. As pregnancy is growing, there are some irregular, painless contractions on the uterus. They come on and off. They come on and off, but they are not painful. Instead, they activate, they stimulate blood circulation in the uterus. We refer to such irregular contractions, we refer to them as Braxton Hicks contractions. There are several presumptive signs, as you will notice on the skin. Because signs on the skin involve some marks you might find on the abdomen of the pregnant woman. There might be a clear dark line from around the navel, from around the umbilical region down, okay? At the center there, it is dark, looking as if it is well painted. It is painted by nature. That pigmentation there, when such a line comes out, we refer to it as linea nigra. Linea nigra. The growing pregnancy may cause overstretching of the abdominal wall, and then the stretch marks present. And stretch marks result from overstretching, whereby some blood capillaries tear within at the level of the subcutaneous layer of the skin, and then even the blood that leaks out of blood capillaries flows beneath the skin. And the epidermis, the covering on top of the skin, it protects it. It's like a reflection beneath the skin. They pass the lines and presenting what we call stretch marks. We refer to them as striae gravidarum. Striae gravidarum. These are signs on the skin of the pregnant woman. And a pregnant woman may start feeling dizzy and complaining dizziness because of the fact that blood flow is slow during pregnancy. Because certain hormones of pregnancy, like the progesterone, relaxes smooth muscles, including those of the blood vessels. And so when a woman seeks upright for too long, blood circulation finds it up to move upward towards the brain. And once the level of blood supply to the brain drops, you feel dizzy and you can even fall, you can even collapse. So people really need to take good care of people who are pregnant. But you see, seeing this as a presumptive signs. Now, I am going to be discussing probable signs and positive signs in our next video. If you are so interested in this video, subscribe, like, and share. My name is Dr. David Ayim. I am a reproductive health expert, and of course I hold a PhD in public health. I am here because I love to coordinate the understanding of this topic, very specific, sensitive areas of reproductive health, so we can share it with you wherever you are on earth. Thank you.